I often talk about the importance of clear, regular communication with your team. And there's no part of your business where communication is more important than in how you expect your therapist to treat and manage your patients. So part of doing this is to create your patient management protocols with your senior team based on how you not only treat, but also how you speak to patients and recommend further treatment. And this includes communication strategies centered around keeping patients engaged. So patient management protocols are frameworks to work under for the most commonly seen conditions in your practice. It's not about creating robots because there's always a need for judgment on how to manage patients, and there should always be that conversation with the patient on what's actually important to them. So therapists can move out of these frameworks, but only on the rare occasion it's required, and there needs to be good clinical reasoning. If you don't have patient management protocols and a framework for your therapist to work within, you normally have Rafferty's rules. So practitioners can manage patients however they like, they can recommend whatever they like, and really speak to your patients however they like. So if you do have a therapist who's not treating patients to your standard, it's okay for them because they'll eventually leave and work somewhere else, but your business is left with the bad service reputation. So they're unwittingly damaging your business and then moving on. Now, the foundation for your treatment protocols is that your practitioners prescribe and recommend the best treatment every time. This needs to be a non-negotiable, so no subconscious judgment based on what a patient might accept or be able to afford. It's about getting your own biases out of the way and proposing the best treatment or the best product or even a follow-up booking. Your practitioners should never finish a treatment with the old line, "Okay, see how you go," through the fear of suggesting a follow-up booking. It's their responsibility to recommend whatever they believe will improve the patient's functionality and quality of life, nothing else. If it helps, your therapist can think about what they would advise if they were treating the practice owner's mother. When treatment's no longer a judgment call and your therapists are working to a set of protocols, treating and recommending becomes easier. It's a system and process they can follow every time without worrying about what do I say or what can I recommend. Now, apart from the obvious benefits, one small side effect of having treatment protocols is an increase in referrals from GPs. A lot of GPs are disgruntled with allied health businesses because there's just no consistency of treatment. They don't know what they'll get from one practitioner to the next. If you can implement treatment protocols within your practice, GPs can refer with confidence, given they know there'll be consistency across patients. Now, it's one thing to establish a clear framework around how to manage patients, but it also needs to be trained and reinforced with your team. So a good way of doing this is for a practice owner to never treat alone. So always have one of your therapists join you in a treatment session to learn how to work to the protocols. It's a great form of training, and you can even have some fun with it by asking your practitioners to review you at the end of the session. So best of luck with setting up your treatment protocols, and I really hope this has helped.